Hi, it's Dr. Nish here, and your child has just fallen and hit their head, and you want to know whether they have a concussion. If they've had any loss of consciousness or they're not acting normally now, then that's a sign of a concussion, and you should seek medical care. If they fell and hit their head and had no loss of consciousness and they cried right away and stopped crying after a few minutes and now are acting normal, those are all good signs that they haven't had a concussion. So what do you do next? Well, a concussion can also show up in the next 2 days after an injury in subtle ways. So how do we tell? Well, a concussion is an injury of the brain. And so since the brain controls everything that we do, any change in behavior from normal behavior can be a hint that there might be a concussion. So your child should sleep when they're supposed to sleep, be awake when they're supposed to be awake, have normal mood, appetite, energy, move all their arms and legs like they normally do, not be more clumsy, and not have any vomiting. If they have none of those and it's been 2 days since the injury, then you're in the clear, no concussion. If there's any lump or bump, then that'll go away in a couple weeks. If you're concerned, ask your pediatrician. You can put something cold or cool on the lump or bump if your child lets you and helps them feel better, but you don't need to force it. You can also use Tylenol or Motrin for any sort of pain or discomfort. It's safe to do, and it won't mask any concussion. You can always ask your pediatrician if you're not sure. So if you're worried your child has a concussion and they've had any of these things that I've mentioned, please see your doctor right away. This is Dr. Nish. Thanks so much for watching. Stay safe.